A very warm welcome, everybody, to this 2-hour session where we're going to explore inclusive systems and services. My name's Lucy Mulvagh and I'm the Director of Policy Research and Impact at the Health and Social Care Alliance Scotland, and I'm absolutely delighted that this event has been organised in partnership between the Alliance, Public Health Scotland and the Improvement Service. And we're very pleased to be joined not only by all of you, our lovely audience, but by a wide range of stakeholders from public sector and third sector organisations across the length and breadth of the country. And as you can see in the chat box, that's really the case. There's people from all over the shop joining us today, which is smashing. So just to note, you may have noticed we're going to be recording part of today's session to help produce a learning note from the discussions. As I've said, please keep your mics turned off if you're not speaking, just to help with background noise. And please feel free to keep your camera turned off or on, whichever makes you feel most comfortable. So the aim of today's session are threefold. We want to raise awareness about why inclusive service design processes are important and how adopting a rights-based approach to service design can promote equity and justice for marginalised peoples and seldom heard communities. We want to identify and learn from examples of work that are already taking place across the country to create more inclusive systems and services. And we want to explore tangible actions that we can all take forward to promote power sharing and co-production between those who use services and those who design and deliver them. So we're very pleased to be joined by a really excellent lineup of speakers who will be helping to kick off our discussions today by sharing learning from work that they're leading on at the national, local and grassroots levels. And one of the things that's quite important about today is that we are extremely keen that it's as interactive as possible. So we want to hear from as many of you as possible today as well. Where are you on your journeys to inclusive systems and services, and what opportunities can you and others identify that we can all use to support and support each other and work towards our shared goal of improving outcomes and reducing inequality for people and communities throughout the country. So, for example, for my organisation at the Alliance, inclusion is at the heart of what we do. And as the national third sector intermediary for health and social care, our vision is for a Scotland where people have a strong voice and enjoy their right to live well with dignity and respect. And we very recently published our 5-year strategic plan, which recognises that it's people-led collaboration across sectors that will deliver the best results for Scotland. We work across a number of areas and work streams to improve people and communities' well-being across the country. And we bring together the expertise of people with lived experience, the third sector and health and social care organisations to do that work to try and improve policy practice and service design and delivery. Because we really believe that together the collective voice is stronger, and we can use that collective voice to make the meaningful change that's needed at the local and the national levels. So today we're going to hear about different approaches that can and have been taken to design inclusive systems and services. And there are many different approaches, and this is a good thing because there shouldn't necessarily be a one-size-fits-all approach to redistributing and sharing power. However, there are some important and necessary ingredients for a rights-based approach to system and service design. And using tools like the Well-Kent panel principles, for example, can help ensure that people's rights are at the centre. We also know that taking a rights-based co-production and co-design approach from the outset gives us the chance to check assumptions, even that a service is actually what's needed or wanted by people and communities. Perhaps it's something else. Like affording greater community empowerment and autonomy. And it also encourages and reinforces the need to ensure adequate and appropriate accountability mechanisms are built in from the start, so we can monitor the extent to which systems and services are inclusive. So as you listen to today's speakers, please do use the chat box to post your questions, share your reflections and so on, because we'll be picking these up later in a part of the session before the end today.